Alright, so let me briefly explain how the surgery will go. So as you can see here, this is the acquired palate defect, and then usually the wound is quite already, is dried out already. So the first step of the surgery, of course, is to clean up the area, remove any debris, these things like that, for example, this one. And then the next thing is for the surgery, it is debridement. So it's removing any dead cells, dead tissues using a fresh scalpel blade. And then usually what I do is I'll just scrape on both sides. And then another part of it is then you will create fresh bleeding edges on both sides. And then fresh bleeding edges on both sides also help to promote healing. And it's also very important to remove all the necrotic dead tissues. So after that, the next thing is then, of course, closure. So you use suture, either non-absorbable or absorbable suture. Non-absorbable would be advantageous because absorbable sometimes it will break off prematurely when the cat instinctively uses his tongue to rub the roof of his mouth, and then that will cause abrasion and mechanic trauma to the suture. So the suture, you'll come in this way, go the other side, and then you tie a knot. So basically it'll be something like this, and then a knot here, and then each sutures will be around like 5 mm apart. And then the next thing is, I guess what we expect is quite challenging this area when the defect is quite wide. So usually a key important thing to take note of is to make sure that the repair, the closure itself has minimal tension. Otherwise, if there's tension at both angles, but both sides pulling the suture apart, then it will increase the risk of repair failure. So the defect will open up again. So then to minimize tension, what we can actually do is to make 2 incisions at both sides. And then these are tension relieving incisions. So then once you make an incision on both sides, you can actually pull these 2 edges towards each other. So then you actually will have like 2 small little holes here. And then these two holes at both sides will actually heal by secondary intention, meaning it will just heal up by itself. And then so that will allow you to pull these edges nearer to each other. They have to be opposing, so these 2 edges have to touch each other. And then the suture will be simple interrupted, basically. Then so you do both sides, so 5 mm apart, as you can see. We'll show an image later of the after. Actually, really depends on how much tension. The interesting part is that here to here is the hard palate, and then here to here is the soft palate. So the soft palate is actually quite flexible, and sometimes you can actually pull both edges to each other without much tension. So you really have to base on a bit of feel to see when you pull, is there how much tension there is. So the main thing is also, what I notice is then if there's like 2 wounds here, because the mouth is so well vascularized with so many blood vessels, so many little capillaries, then you can actually bleed quite a bit. Then that's actually quite normal. The main thing is then to apply pressure using a gauze or something like that to allow the capillaries to clot and then to stop bleeding. So this is the post-surgical photo, and then as you can see, the sutures are actually quite close to each other, almost forming a straight line. This is because they are actually 5 mm apart from each other. And then on both sides of the surgical repair, you can see 2 red lines, and that is the tension relieving incision.